Several White House staffers and members of the Secret Service who work in close proximity to the president on a daily basis have now tested positive for COVID-19. We know that. Fox News also confirms one of them, as David just mentioned for us, is the Vice President's press secretary, Katie Miller. Joining us to break down testing efforts at the White House and across the nation is Director of Harvard's Global Health Institute, Dr. Ashish Jha. Dr. Jha, we always love speaking to you. Thanks so much for taking time again out of your very busy weekend for us. We appreciate it.
My pleasure. Thanks for having me on.
So first question is about these White House staffers, and then we'll open up the conversation to testing more generally. The White House says they're now going to test everybody who comes into close proximity with President Trump to prevent higher probability of him contacting the virus. That sounds great, but tell us, does that, is this even a realistic goal in the sense that you can test somebody once and know that they're fine that day, but then if they're going to just see the president the day after, are they going to be testing White House staffers every single day, and is that what they would need to do?
Yeah, so it just tells you how difficult it is to maintain a completely safe environment. And obviously, keeping the president and the vice president safe are of the highest priority. And so I think they probably do need to be doing daily testing, but even that isn't going to be 100% foolproof because we know that you can have the virus and test negative. It's just not a perfect test. It's a pretty good test, but it's not perfect. So I understand the strategy they're using. I think it's the right strategy. But it's a reminder that even in the White House, with daily testing of all the staff, it's not 100% in terms of making sure that no one who's infected gets near the president.
Is there any way to get to 100%, or you're saying that's just take it off the table? It's not something that anyone could realistically do?
So again, the goal is, 100% I don't know how we get to, but you can get pretty close, right? And the way you do it is you limit the number of contacts to the president. You do make sure you test all those people. You keep those people reasonably quarantined. So those people should not be going out to restaurants and bars, not that bars are even open, but keep those people in relatively confined spaces. And I think you can protect the president. I'm not saying it's impossible. I'm just saying 100% is always hard, but you can get pretty close with lots and lots of testing.
So now when we look at the rest of the United States, we're kind of split between states that are staying shut, states that are reopening or trying to reopen their economies. You say, there's these widespread protests now against certain businesses that are staying, against governments that are keeping businesses closed, But you say to those folks, don't hate the stay-at-home orders, hate the lack of testing that got us to those policy solutions in the first place, right?
Yeah, so look, even the president, just by his action, what's happening at the White House, it's an acknowledgement that testing is really helpful. It's not the only thing we need, but it's a really critical part of keeping America safe. And my take is, if that's the strategy the White House is using to keep that workplace safe, that's the strategy we all should be using. Now, again, not everybody needs to be tested every day. But we do need a lot more testing as a key part of keeping people safe so that we can open up safely and get our economy back and make sure that people don't get infected and die in large numbers. We can do both of those things, keep people safe and open the economy. But testing is a really fundamental part of that.
Yeah. Good reminder there. Good point that maybe the White House on this is leading by example. So when the president talks about testing not being a universal necessity, look at what the White House staff is implementing to keep him safe. I want to get your final thoughts on this terrible news we're hearing now, where a number of children, I don't want to misstate what's happening, so correct me if I get this wrong, but a number of young children are getting these sort of secondary inflammatory diseases resulting from COVID-19. We know that one 5-year-old now has died in New York. Tell us about what you see in this sort of new developing piece of the puzzle.
Yeah, so one of the bright spots of this terrible pandemic, and one of the sort of silver linings, has been that kids have generally done very well. They do get infected, they do spread the disease, But they generally themselves don't end up getting very sick. And it's very, very rare when kids die. Obviously, anytime a child dies of anything, including COVID, it's a tragedy. What we are seeing is that we're learning a lot about this virus, including that it sets off an immune reaction that in kids can really cause a lot of difficulties. Again, most kids still end up getting through it okay. I don't want people to get excessively worried. But it is something we're going to have to watch carefully and learn more about. Because obviously, if it leads to kids getting very sick, that is something we're going to have to pay a lot of attention to.
And obviously, it would be a very devastating game changer, not just for Americans, but for folks all over the world. Dr. Jha, we'd love to get you back soon. Thanks for sharing your expertise with us today.
Thanks for having me on.